What we've noticed over the past several weeks is a steady increase in the number of COVID patients that we've seen. And we've noticed that really both on the outpatient world and on the inpatient world. We run our drive-through testing site down at the Emerson Street station. And when we were at a lull in COVID activity, the percentage of those tests that returned positive was about 2% or so, and we've seen a steady increase up to about 10% and sometimes as high as 15 or 16% positive results on a daily basis. So we're really seeing an increase in the percentage of positive tests that we've seen on the outpatient side of things. Unfortunately, we've also seen a similar increase in the number of COVID patients that we're taking care of in the hospital. And predominantly, these are patients from our primary four-county area, Chelan, Douglas, Grant, and Okanagan counties. And as of yesterday, we had 19 patients in the hospital, but 7 of those patients were requiring care in the intensive care unit, and 4 of those patients were on ventilators. So it's obviously requiring a lot of hospital resources again as the number of COVID patients we're taking care of in the hospital is increasing. So it's a concerning trend that we're seeing a rise in COVID cases throughout our region, and it's becoming increasingly taxing on our healthcare system as well. I think if things continue on the trajectory that they are now, it's very likely that we're going to have to reduce some of the procedural or surgical services that we provide. My hope and the hope of everyone here is that we don't have to decrease it to the point that we did in March and April, but we probably will have to decrease it to some extent. You know, we do have a limited number of staffing and resources, and the fact of the matter is if the number of COVID patients we have require more of those staff and resources to care for them, it just leaves less to care for other people. And as much as we don't want to decrease routine or elective care, we may well have to do that if this trend continues. We have our kind of contingency plan right now capable of going up to an ICU capacity of about 25. So 25 people potentially requiring ventilator support. So it would be, quite frankly, a challenge to staff all of those 25 beds. So if we ever got to a level that required that, we would have to significantly draw down some of the other services that we provide. We hope we don't get there, but that's kind of our maximum number that we plan on. I think it's important to remember what we can all do to try to prevent this spread of this virus. It's very easy for us to let our guard down as the community starts opening up again, but I think it's really important not to let our guard down right now. We have to continue being vigilant about wearing masks. You know, wearing a mask, if I have COVID and don't know it because I don't really have symptoms, the likelihood that I pass that virus to someone else probably decreases by about 90% if I'm wearing a mask. Conversely, if I'm wearing a mask and someone else is sick around me, it probably decreases my chance of catching it about 20%. So I think we have enough data, clear data at this point to say masking helps. So I think having everyone in the community continue to be vigilant about masking is really important. I think social